Hi, I'm Natasha Levester, and today I'm going to be doing my complex disease process teaching about hypertension. High blood pressure, also known as hypertension, is defined as the high pressures in the artery in which the vessels carry the blood from the heart to the rest of the body. Most people with high blood pressure will not experience any symptoms. It is also known as the silent killer for this reason. In the United States, approximately 85 million people have high blood pressure, and that's about one in every three adults over 20, and that's according to the American Heart Association. If left untreated or uncontrolled, high blood pressure can lead to many other health problems. These conditions include heart failure, vision loss, stroke, and even kidney disease. In the African American community, hypertension has a high prevalence in the community and it is associated with a lot of complications related to noncompliance with the medications. Therefore, this is why I'm presenting this subject to you today. If a person has high blood pressure, it means the walls of their arteries are receiving too much pressure on a constant basis. The cause of high blood pressure are broken down into two categories. These are essential and secondary. Essential high blood pressure means that there is no essential cause for having high blood pressure. And the secondary high blood pressure means that there is something causing you to have the high blood pressure. There are many factors that contribute to having an increase in blood pressure. These main factors may be contributed to these factors can be modified or not modified. Factors that can be modified to help decrease your chances of getting high blood pressure include a sedentary lifestyle, which means that you don't do much physical activity, an increase in your weight, smoking, your alcohol consumption, and how much stress that you put on yourself. The factors that you have that cannot be modified for the diagnosis of hypertension are your age, as your chances increases as you get older, your sex, so being male or female, your race, so African Americans have a higher prevalence of hypertension, if you have a family history, and if you have certain diseases like type 1 diabetes. Hypertension is known as the silent killer because some people will never present with any symptoms while others may. Therefore, it is important to get your yearly physical exams because the presentation of the disease can go without any symptoms. You need to routinely have your blood pressure monitored. And on the other hand, some people may present with symptoms. These include headache, blurred vision, nausea, vomiting, an irregular heartbeat, and as well as a nosebleed. The most significant thing you can do to pay attention is that you have a headache that is unrelieved. If you take something over the counter like Tylenol or ibuprofen, that's usually a sign that it's your blood pressure and actually not a headache. Also, if you have a new onset of a headache that is so severe that you have never experienced before, that is something you would want to get checked out as well. When you come to the doctor's office, the medical assistant or the nurse will take your blood pressure. And they'll either take it by a machine, the ones that you see roll in, I call a Dynamap, or they will take it with a traditional blood pressure cuff, which we will place around the cuff around your arm. And you will see that it has little things on the front to tell you to place it directly over the artery. So you're going to place that over the artery. And it's got a little hook on it to put this on there so we're able to read your blood pressure as we are listening, because we're going to be listening with the stethoscope. This is what we're going to place over your artery. We're going to use the bulb, and we're going to twist it, and we're going to inflate the cuff. And we're going to inflate it, and then we're going to release the button, and it's going to deflate. And as we're deflating it very slowly, we'll start to hear a noise from your artery when the pressure comes in and then when the pressure diminishes. And that is how we determine is your blood pressure. The first number value that we hear is considered the systolic number, and that's the number that the heart is the number that shows what the heart is pushing the blood through the arteries at. And the last number we hear while the cuff is deflating is how much pressure your blood is at once your heart is relaxed. And them come in two numbers. So it'll be 120 over 80, which is the normal, and what they want your blood pressure to be. Anything over 140 or 90 is considered hypertension. There are other tests that doctors can perform to show symptoms that are associated with causing other disease processes by hypertension. The doctor can order a urine screen, which will look for proteins that show during when your kidneys are failing because of the increased pressure of hypertension. They can also hook you up to an EKG, which is an electrocardiogram that is going to be checking your heart conduction, which can show arrhythmias or conduction problems that are caused by hypertension due to the thickening of the valves. They also can do an ultrasound of your heart to see the thickening of the valves, which is called an electrocardiogram. The treatment of high blood pressure is very important because without treatment, it can cause many issues and even lead to death. Certain diseases that may accompany high blood pressure is kidney disease because of the increased pressure in the kidneys. It begins to damage the blood vessels and decrease the kidney function. It can also cause a stroke because of the weakening of the artery walls in your brain will result in bleeding on the brain. It can also cause an ischemic stroke because of atherosclerosis, which is another complication of hypertension, and that's where plaque builds up on the walls of your arteries, and one of the plaques can become dislodged and travel to your brain or even your heart and cause a heart attack. Heart failure is also a common problem associated with hypertension because your heart is working so hard to push the blood through your body that it's becoming enlarged and weak and it eventually fails. These are just a couple of disease processes that can go along with hypertension, but there are many more. To decrease your chances of getting hypertension, simple lifestyle changes can be made to decrease your blood pressure, like limiting the amount of salt and fat in the diet, eating potassium-rich foods like bananas, regular exercise, not smoking, limiting alcohol, losing weight, relaxation, and getting good sleep. For the non-modifiable components of blood pressure, like your age, sex, and race, at that time medications will become part of the treatment plan. There are many classes and types of medications that can be prescribed for hypertension. My recommendation for that is to pay attention to what you're being prescribed and research it because there are a lot of side effects that can be associated with medications, and that is the main reason why a lot of people stop taking their hypertension medication because of the side effects that are associated with it, especially males. The erectile dysfunction or the sexual fact is a main reason why they will stop taking the medication. So that's why it's important to have an open relationship with your doctor and able to discuss these side effects with them. So instead of just stop taking the medications, you can address it with him and maybe change the medications. Or if you give it time, because it takes a couple weeks for your body to become adjusted to certain medications, the side effects may disappear on their own. So there may not even be needing to be a change made to the medication. It just your body needed time to get used to it. With the medication and lifestyle changes, hypertension can be well controlled and may never lead to secondary issues. The prognosis is good with proper diet, exercise, and medication compliance. The prognosis can become poor if treatment plan is not followed and may lead to other devastating disease processes. These can be very debilitating diagnoses or even lead to death. So remember to keep a monitor on your blood pressure and make sure treatment that is prescribed for you is working because the same treatment doesn't work for everyone. Having a diagnosis of hypertension is not a death sentence, but it can be if it's not properly treated. Get your yearly physicals and monitor your blood pressure on a regular basis to keep track of it. If you don't get diagnosed with high blood pressure, remember the simple lifestyle. If you do get diagnosed with hypertension, remember simple lifestyle changes to help modify factors to hypertension may not require medication management at that time to control it. However, if medication is required, then compliance to the medication is very important because without the medication, the disease process will continue and lead to other diseases and even death. Remember to always talk to your doctor about unwanted side effects and medications instead of stopping them. And be vigilant about the care of your blood pressure can help and prevent future complications down the road, and you'll live a normal, happy life. And one of the other factors that do contribute to people not being compliant with medication is the cost of medication. So if this is also one of the issues that you come across, also bring this up with your doctor because a lot of pharmacies have cheap generics and they have a list that the doctors can view and prescribe you something for your blood pressure. And also when it comes to knowing your medications, certain medications excrete potassium, and that is also a major function when it comes to your heart. So you will want to have your potassium monitored on a regular basis, and you don't want to consume too little or too much potassium as it can build up in your blood. And thank you for listening to my lecture. I have attached a handout for you to read.